Question 1. An RBT is implementing a token economy. The client earns tokens for completing math problems, but loses tokens for calling out. Sometimes the client earns enough tokens for backup reinforcers, but sometimes they lose all tokens and get frustrated. Which component might need adjustment to make the system more effective, especially considering the client's frustration when losing all tokens? A. The schedule of reinforcement for earning tokens. B. The definition of the target behavior, math problems. C. The cost response, losing tokens, value, or criteria. D. The selection of backup reinforcers. Answer: C. The cost response, losing tokens, value, or criteria. This question probes your understanding of token economies, and specifically the cost response component, which is a form of punishment. The keywords are loses tokens, loses all tokens, and frustrated, suggesting the punishment aspect might be too harsh or applied too frequently. While other components are important, the direct cause of frustration mentioned is losing all tokens. Adjusting the cost response, perhaps making the penalty less severe, losing fewer tokens, or changing when tokens are lost, might prevent the client from hitting zero and reduce frustration, keeping them engaged. For example, instead of losing 5 tokens for calling out, maybe they only lose 1. Remember, token systems need careful balancing. If the cost is too high, it can discourage participation. Question 2. A supervising BCBA asks an RBT to measure the time between when a client is told, "Put your shoes on," and when the client's foot actually makes contact with the inside of the shoe. Which specific measurement dimension is this? A. Interresponse time, IRT. B. Rate. C. Latency. D. Duration. Answer: C. Latency. This question requires you to precisely identify a type of temporal measurement based on its definition. The key is measuring the time between the instruction, SD, and the initiation of the specific response, foot touching inside the shoe. Latency measures the time elapsed from the onset of a stimulus until the response begins. It's not IRT. Time between 2 consecutive responses, rate, frequency over time, or duration, how long the behavior lasts. Think of it like measuring the delay before the action starts after the cue. So, latency equals lag time before the behavior begins. Question 3. During a session, an RBT notices the client engaging in a high rate of a previously extinguished behavior, example, whining for attention. This sudden, temporary increase in the problem behavior after extinction procedures were implemented is known as A. Spontaneous recovery. B. Resurgence. C. Resistance to extinction. D. Extinction burst. Answer: D. Extinction burst. This question tests your knowledge of phenomena associated with extinction procedures. The keywords are sudden, temporary increase in behavior after extinction started. An extinction burst is a predictable, temporary increase in the frequency, intensity, or variability of the behavior being extinguished right after the reinforcement is removed. Spontaneous recovery happens later, after the behavior has already decreased. Resurgence is the reappearance of a previously reinforced behavior when another behavior is put on extinction. Resistance refers to how persistent the behavior is against extinction. That initial flare-up when you first start ignoring a behavior. That's the extinction burst. Question 4. An RBT is working with a nonverbal client who points to desired items. The BCBA wants to teach the client to use a simple sign for more. The RBT models the sign and physically guides the client's hands to form the sign when they point. This use of physical guidance is an example of what type of prompt? A. Gestural prompt. B. Verbal prompt. C. Model prompt. D. Physical prompt. Answer: D. Physical prompt. This question asks you to identify a specific type of prompt based on the RBT's action. The critical phrase is physically guides the client's hands. A physical prompt involves direct physical contact to help the learner complete the behavior correctly. This ranges from full physical guidance, like moving their hands through the whole motion, to partial physical guidance, like a light touch on the elbow. It's different from gesturing, pointing, verbal cues, spoken words, or modeling, showing the action. If you're physically touching the client to help them do the skill, it's a physical prompt. Question 5. A behavior intervention plan, BIP, includes a strategy where the RBT provides reinforcement every time the client emits a specific behavior that is physically impossible to do at the same time as the target problem behavior. For example, reinforcing quiet mouth/humming instead of screaming. What type of differential reinforcement is this? A. Differential reinforcement of alternative behavior. Dre. B. Differential reinforcement of other behavior. Dro. C. Differential reinforcement of incompatible behavior. DRI. D. Differential reinforcement of lower rates of behavior. DRL. Answer: C. Differential reinforcement of incompatible behavior. DRI. This question requires discriminating between different types of differential reinforcement. The key clue is reinforcing a behavior that is physically impossible to do at the same time as the problem behavior. DRI specifically involves reinforcing a behavior that cannot co-occur with the challenging behavior. Quiet mouth/humming is incompatible with screaming. This differs from DRA. Reinforcing a functional alternative, which might not be physically incompatible. DRO. Reinforcing the absence of the behavior. And DRL. Reinforcing reduced rates of the behavior. Think DRI equals incompatible. Can't do both at once. Question 6. An RBT is collecting data using momentary time, sampling on a client's on-task behavior during homework time. The observation period is 20 minutes, divided into 1-minute intervals. The RBT only records whether the client is on task at the precise moment each interval ends. What is a potential disadvantage of this measurement method? A. It consistently overestimates the occurrence of the behavior. B. It requires the behavior to occur throughout the entire interval. C. It can miss occurrences of the behavior that happen between observation points. D. It is best suited for measuring behaviors that are intended to be reduced. Answer: C. It can miss occurrences of the behavior that happen between observation points. This question assesses your understanding of the limitations of specific discontinuous measurement systems. Momentary time sampling involves recording behavior only if it occurs at the exact end of the interval. The keyword is precise moment each interval ends. Because you're only looking at that split second, you could easily miss brief instances of the behavior that occur during the interval, but not right at the end, or even longer durations that end just before the check-in moment. This can lead to underestimation. Partial interval tends to overestimate, and whole interval requires behavior throughout. Remember, momentary is just a snapshot at the end, so it can miss things. Question 7. The RBT ethics code emphasizes maintaining professional boundaries. Which of the following situations represents the most significant potential for a problematic dual relationship? A. The RBT attends the same large community festival as a client's family. B. The RBT accepts a small, inexpensive handmade card from a client at the end of services. C. The RBT agrees to babysit for their client on the weekends for extra money. D. The RBT learns that their cousin is the client's classroom teacher. Answer: C. The RBT agrees to babysit for their client on the weekends for extra money. This question tests your ability to identify dual relationships that pose ethical conflicts. A dual relationship occurs when you have a professional role and another type of relationship, personal, financial, etc., with the same person. The key is identifying the situation with the highest risk of impairing objectivity and creating conflicts of interest. Babysitting involves a secondary financial and personal relationship directly with the client/family, blurring lines significantly. Attending the same large event, A, is usually fine if interactions remain professional. Accepting a small token gift, B, is often acceptable per agency policy. Knowing a relative is involved, D requires disclosure to the supervisor but isn't a direct relationship initiated by the RBT. Avoid mixing professional roles with personal or business dealings with clients. Question 8. A client has learned to identify the color red when shown a red block and asked, "What color?" To ensure the skill generalizes appropriately, the RBT should also practice this skill using A. Only the original red block in the same therapy room. B. Different shades of red objects, example, red car, red crayon, red shirt. C. Only non-red items to ensure discrimination. D. The exact same as D. What color? Without variation. Answer. B. Different shades of red objects, example, red car, red crayon, red shirt. This question focuses on the concept of generalization, specifically stimulus generalization. The goal is for the client to apply the learned skill, identifying red, across different relevant stimuli. Sticking to only the original block, A. Hinders generalization. Using different red items, B. Helps the client learn that red applies to many things, not just the specific block. Option C focuses on discrimination, telling red from not ready, which is also important but doesn't address generalizing the red label itself. Varying the SD slightly might also be part of generalization training, but varying the stimuli is crucial here. To make skills useful, practice them with different examples the client will encounter in real life. Question 9. An RBT is tracking a client's elopement behavior, running away. The BCBA wants to understand the typical amount of time that passes between one instance of elopement and the next one. What measurement should the RBT use? A. Duration. B. Frequency. C. Latency. D. Interresponse time, IRT. Answer. D. Interresponse time, IRT. This question asks you to select the measurement that captures the time between instances of the same behavior. The key phrase is time that passes between one instance and the next one. Interresponse time, IRT, measures the elapsed time between two successive responses. This helps understand how behaviors are spaced out over time. It's not duration, how long one elopement lasts. Frequency, how many times they elope, or latency, time from a cue to the start of elopement. Think IRT equals time in between responses. Question 10. When reviewing a client's behavior intervention plan, be a P. The RBT notices it includes teaching the client to ask for a break instead of swiping materials off the table. This asking for a break skill serves the same function, escape from task, as the problem behavior. What is the technical term for this type of replacement skill? A. Functionally equivalent replacement behavior. B. Incompatible behavior. C. Alternate response. D. Competing behavior. Answer. A. Functionally equivalent replacement behavior. This question tests your understanding of the terminology used in function-based interventions. The critical clue is that the replacement behavior, asking for a break, serves the same function, escape, as the problem behavior, swiping materials. A functionally equivalent replacement behavior is an appropriate behavior that allows the client to achieve the same outcome or meet the same need as the challenging behavior. While it might also be an alternate or competing behavior, the most precise term emphasizing the functional match is functionally equivalent. DRI uses incompatible behaviors, which isn't necessarily the case here. Always aim to teach replacement skills that work just as well as the problem behavior for the client. Question 11. An RBT is implementing a shaping procedure to teach a child to say cookie. The RBT initially reinforces coo, then cook, and finally cookie. What dimension of behavior is primarily being shaped in this example? A. Topography. B. Frequency. C. Latency. D. Magnitude. Answer. A. Topography. This question requires knowing the different dimensions of behavior that can be shaped. Shaping involves reinforcing successive approximations towards a target behavior. Here, the approximations, cook, are changes in the form or physical movements involved in producing the sound. Topography refers to the physical form or shape of a behavior, what it looks like or sounds like. We are changing how the child says the word, not how often, frequency. How quickly they start, latency, or how loud, magnitude. Think topography equals the form or structure of the response. Question 12. A supervisor observes an RBT consistently forgetting to take data on a target behavior during busy group activities. According to the RBT ethics code, what is the supervisor's primary responsibility in this situation? A. Report the RBT to the BACB immediately for incompetence. B. Take over data collection for the RBT during group activities. C. Provide additional training and support to the RBT on data collection methods. D. Modify the client's BIP to remove the target behavior during group time. Answer: C. Provide additional training and support to the RBT on data collection methods. This question addresses the supervisor's role in ensuring RBT competence. The RBT ethics code requires supervisors to provide adequate training and oversight. If an RBT is struggling, consistently forgetting, the supervisor's primary ethical duty is to provide corrected feedback, additional training, and support to help the RBT improve their skills, reporting to the BACB. A is typically reserved for more serious, unresolved issues. Taking over the task. B doesn't build the RBT's skill. Modifying the plan because the RBT can't collect data. D avoids the core issue of RBT competence. Supervision is about support and skill development first. Question 13. An RBT is teaching a client to follow multi-step instructions using a forward chaining procedure. Which step accurately describes how forward chaining works? A. Teaching the last step of the sequence first, then the second to last, and so on. B. Teaching all the steps simultaneously and reinforcing completion of the full chain. C. Teaching the first step of the sequence, then the first and second steps combined, then the first three, etc. D. Allowing the client to attempt the entire chain and prompting only when errors occur. Answer: C. Teaching the first step of the sequence, then the first and second steps combined, then the first three, etc. This question requires knowledge of a specific chaining procedure. Forward chaining involves teaching the behavioral chain beginning with the first step. Once the first step is mastered, the trainer teaches the first and second steps together, then the first three, and continues adding steps sequentially until the entire chain is learned. This contrasts with backward chaining, A, which starts with the last step, and total task presentation, B/D, where the learner is guided through all steps from the beginning. Think forward chaining equals start at the beginning and add steps one by one. Question 14. A client engages in property destruction, throwing objects, when presented with difficult academic tasks. An FBA suggests the function is escape. The BIP includes prompting the client to request help using a picture card before throwing occurs. This strategy of prompting a replacement behavior before the problem behavior happens is best categorized as A. Reactive strategy. B. Consequence manipulation. C. Antecedent intervention. D. Punishment procedure. Answer: C. Antecedent intervention. This question asks you to classify an intervention based on when it's implemented relative to the behavior. The key is that the prompting occurs before throwing occurs to prevent it. Antecedent interventions are strategies implemented before the target behavior to increase the likelihood of a desired behavior or decrease the likelihood of an undesired behavior. Providing prompts, modifying tasks, offering choices, or enriching the environment are all antecedent strategies. Reactive strategies and consequence manipulations happen after the behavior. Punishment also follows behavior. Think antecedent equals before the behavior happens. Question 15. An RBT is asked to implement a new skill acquisition program involving stimulus fading. Which of the following best describes stimulus fading? A. Gradually reducing the intensity or intrusiveness of a prompt, example, physical guidance to shadow. B. Gradually changing the physical properties of the stimulus itself to guide the response, then fading those changes. C. Gradually increasing the time delay between the natural stimulus and a prompt. D. Gradually thinning the schedule of reinforcement from continuous to intermittent. Answer. B. Gradually changing the physical properties of the stimulus itself to guide the response, then fading those changes. This question tests your understanding of a specific prompting and fading technique, stimulus fading. Stimulus fading involves exaggerating or altering some physical dimension, like color, size, position, of the correct stimulus, SD, to make it more noticeable, and then gradually fading that exaggeration back to the natural stimulus. This differs from prompt fading, A, which fades assistance added to the task, time delay, C, which fades prompts by increasing time and reinforcement thinning. D, for example, making the correct picture card brighter than the others, then slowly making it the same brightness. Think stimulus fading equals changing the look of the target itself temporarily. Question 16. While working in a client's home, the RBT overhears the parents having a loud, intense argument unrelated to the therapy session. The client is present and appears visibly upset. What is the RBT's most appropriate immediate action? A. Intervene in the argument and try to mediate between the parents. B. Ignore the argument and attempt to continue the session as planned. C. Immediately end the session and report the incident to the supervisor. D. Calmly redirect the client to a different area if possible, ensure their safety, and document/report the incident to the supervisor. Answer. D. Calmly redirect the client to a different area if possible, ensure their safety, and document/report the incident to the supervisor. This question presents a complex ethical and safety scenario. The RBT's primary responsibility is the client's well-being and safety within the session context. Intervening in a parental argument, A, is outside the RBT's role and potentially unsafe. Ignoring a client's distress, B, is inappropriate. Immediately ending the session, C, might be necessary in some cases, but the first step should be mitigating the immediate impact on the client if feasible. Redirecting the client to a quieter space, D, prioritizes their emotional safety, followed by mandatory documentation and reporting to the supervisor, who can then address the issue at a higher level. Client safety first, then report. Question 17. A supervisor asks an RBT to use differential reinforcement of other behavior, DRO, to decrease a client's interrupting. Which implementation strategy correctly applies DRO? A. The RBT provides reinforcement whenever the client waits for a pause in conversation before speaking. B. The RBT provides reinforcement after a specific time interval, example, 5 minutes, if the client did not interrupt during that interval. C. The RBT provides reinforcement if the client interrupts fewer than 3 times in an hour. D. The RBT provides reinforcement when the client uses a quiet voice instead of interrupting loudly. Answer. B. The RBT provides reinforcement after a specific time interval, example, 5 minutes, if the client did not interrupt during that interval. This question requires you to correctly identify the procedure for DRO. DRO involves delivering reinforcement contingent on the absence of the target problem behavior for a specified period. The key is reinforcing when the behavior doesn't happen. Option B accurately describes this. Reinforcement follows a period of non-occurrence. Option A describes DRA/DRI. Reinforcing an alternative/incompatible behavior. Option C describes DRL. Reinforcing lower rates. Option D also sounds like DRA/DRI. Reinforcing an alternative form. Think DRO equals reinforcement for 0 occurrences of the behavior in the interval. Question 18. What is the primary reason RBTS must adhere strictly to the data collection methods specified in the behavior plan? A. To make data collection faster and easier for the RBT. B. To ensure the data accurately reflects the client's behavior for informed decision-making. C. To satisfy insurance company requirements exclusively. D. To prevent the client from knowing their behavior is being measured. Answer. B. To ensure the data accurately reflects the client's behavior for informed decision-making. This question highlights the importance of accurate data collection. The core purpose of collecting data in ABA is to monitor client progress and make objective decisions about the effectiveness of interventions. Using the specified methods consistently ensures that the data is reliable and valid, meaning it accurately measures what it's supposed to. Inconsistent or incorrect data collection leads to flawed analysis and potentially ineffective or even harmful treatment changes. While data might influence insurance, C, or seem easier one way or another, A, the primary clinical reason is accurate measurement for decision-making. Good data leads to good decisions. Question 19. An RBT is working with a client who engages in frequent hand-mouthing. The BCBA suspects the function is automatic reinforcement, sensory stimulation. Which of the following intervention components would be least likely to be effective if the function is indeed automatic? A. Providing alternative sensory activities, example jewelry, fidget toys. B. Teaching the client to request breaks from tasks. C. Blocking the hand-mouthing response when it occurs. D. Implementing a DRO procedure, reinforcing periods without hand-mouthing. Answer. B. Teaching the client to request breaks from tasks. This question tests your understanding of function-based intervention, specifically for automatically reinforced behaviors. If a behavior provides its own reinforcement, feels good, relieves boredom, interventions usually focus on providing alternative sources of stimulation. A. Blocking the response. C. Or reinforcing its absence. D. Teaching a break request. B. Is typically an intervention component when the function is escape from demands. Since the hypothesized function here is automatic/sensory, teaching an escape-related skill is unlikely to address the motivation behind the hand-mouthing. Match the intervention to the behavior's function. Question 20. During a discrete trial training, DTT, session, the RBT presents the instruction, touch blue. The client touches the yellow card. The RBT says, no, removes the materials briefly, and then represents the trial. This sequence following the incorrect response is an example of A. Positive punishment procedure. B. Negative reinforcement procedure. C. Error correction procedure. D. Extinction procedure. Answer. C. Error correction procedure. This question asks you to identify a specific component within DTT related to handling incorrect responses. The sequence described, providing corrective feedback, no, briefly pausing/resetting, and representing the learning opportunity is a common error correction procedure. Its goal is to provide immediate feedback and another chance to respond correctly, often with prompting on the representation. It's not positive punishment, which involves adding an aversive stimulus, negative reinforcement, removing an aversive to increase behavior, or extinction, withholding reinforcement for a previously reinforced response. Error correction is about teaching the right response after a mistake. Question 21. Which of the following best describes treatment integrity, also known as procedural fidelity? A. The degree to which a client likes the intervention procedures. B. The extent to which the intervention is implemented exactly as written in the behavior plan. C. The overall effectiveness of the behavior plan in changing behavior. D. The process of updating the behavior plan based on new assessment data. Answer. B. The extent to which the intervention is implemented exactly as written in the behavior plan. This question defines a critical concept related to intervention implementation. Treatment integrity, or procedural fidelity, refers to how accurately and consistently the intervention steps outlined in the behavior plan are carried out by the implementers, like the RBT. High integrity means the plan is being followed precisely. Low integrity means steps are being missed, added, or changed. It's crucial because if a plan isn't working, we need to know if it's because the plan itself is flawed or if it just wasn't implemented correctly. It's about doing the plan right, not about client liking. A. Overall outcome. C. Or updating the plan. D. Stick to the plan. That's treatment integrity. Question 22. An RBT is preparing for a session and notices the client's behavior plan includes extinction for escape-maintained whining. During the session, when the client starts whining to avoid a task, the RBT should ideally A. Immediately provide attention and comfort to stop the whining. B. Offer the client a choice of a different preferred task. C. Continue presenting the task demand and withhold reinforcement. Escape for the whining. D. Tell the client, stop whining, and implement a timeout procedure. Answer. C. Continue presenting the task demand and withhold reinforcement. Escape for the whining. This question assesses your ability to apply an extinction procedure based on the identified function. The plan specifies extinction for escape-maintained whining. Extinction means withholding the specific reinforcement maintaining the behavior. Since the function is escape, the reinforcement is getting out of the task. Therefore, implementing extinction correctly means not allowing escape when whining occurs. The task demand should continue or be represented E, and escape should not be granted based on whining. Providing attention, A, or choices, B, might reinforce the whining or be inappropriate in tested strategies here. Punishment, D, is not extinction. Extinction for escape means not letting the behavior result in escape. Question 23. A contingency describes the relationship between a behavior and its consequence. A positive reinforcement contingency means A. A stimulus is removed after a behavior, increasing the future likelihood of that behavior. B. A stimulus is added after a behavior, decreasing the future likelihood of that behavior. C. A stimulus is added after a behavior, increasing the future likelihood of that behavior. D. A stimulus is removed after a behavior, decreasing the future likelihood of that behavior. Answer. C. A stimulus is added after a behavior, increasing the future likelihood of that behavior. This question tests the fundamental definition of positive reinforcement. The term positive in ABA means a stimulus is added or presented following the behavior. The term reinforcement means the consequence increases the future probability of that behavior occurring again under similar conditions. Putting those together, positive reinforcement is when adding something desirable after a behavior makes that behavior more likely to happen in the future. Option A is negative reinforcement, B is positive punishment, and D is negative punishment. Remember, positive equals add, reinforcement equals increase. Question 24. An RBT is using a multiple stimulus without replacement. MSWO? Preference assessment. They present an array of 5 items. Ask the client to pick one. Let the client interact with it briefly, and then present the remaining 4 items on the next trial. What is the primary advantage of this method compared to a simple paired stimulus assessment? A. It takes less time to complete than presenting items in pairs. B. It clearly identifies items the client actively dislikes. C. It establishes a hierarchy of preferences among multiple items more efficiently. D. It can be used with clients who cannot make choices between 2 items. Answer. C. It establishes a hierarchy of preferences among multiple items more efficiently. This question asks about the benefits of a specific preference assessment method, MSWO. The key feature of MSWO is presenting multiple items at once and allowing the client to select one, which is then removed. This process continues until all items are chosen or the client stops choosing. This allows the assessor to quickly see the order in which items are selected, providing a ranked list or hierarchy of preferences from most to least preferred among the presented array. While it might be quicker than some paired stimulus formats, A, its main advantage is the efficient generation of this hierarchy. C, paired stimulus can also create a hierarchy, but often takes longer. Remember, MS-DOO helps rank multiple items quickly. Question 25. An RBT is required to graph client data regularly. What is the most important reason for visually analyzing graphed data in ABA? A, to make session notes look more professional and complete. B, to allow for ongoing monitoring of behavior patterns and intervention effects. C, to satisfy the requirements of the RBT certification board during audits. D, to provide parents with a colorful summary of their child's activities. Answer: B, to allow for ongoing monitoring of behavior patterns and intervention effects. This question focuses on the purpose of graphing and visual analysis in ABA. Graphing data allows practitioners to see patterns and trends over time that might not be obvious from raw numbers alone. Visual analysis of these graphs is the primary way ABA professionals monitor client progress, evaluate the effectiveness of interventions, is the behavior changing in the desired direction, and make timely, data-based decisions about treatment adjustments. While graphs are professional, A, required, C, and can be shared with parents, D, their fundamental clinical purpose is ongoing monitoring and data-based decision-making. B, graphs help us see if what we're doing is working.